What's your opinion on vitamin K that's being administered to newborns?
My opinion is that the more I read about vitamin K, the more I can't believe that it's injected into newborn infants, and that if you look at my scientific endeavors have really shown me that by and large, nature overall didn't make mistakes like this. Nature didn't leave out vitamin K from babies, and that until babies are 6 months old, they're not actually having a full coagulation, normal coagulation. So there's a reason, just like babies are programmed to be anti-inflammatory, I believe that babies are programmed to not have numerously higher levels of coagulation than adults. Also, if you look at the coagulation supposed deficits that a baby has, it's not just the vitamin K factors. So I would suggest that you read a lot about it and consider if you feel better about giving it, then only give the drops. But most people I know who understand the difference don't give any at all. And if you do give it, maybe it would just be if there was an extremely traumatic birth. But you have to understand some of the things that medical interventions do at birth. For instance, when the baby is born, what happens is it's a very tight passageway, as we all know. And so the baby is squeezed very tightly. The cranium is made so that it can compact in on itself. The brain is squeezed. There's trauma all throughout the body. About 30% of babies will have microhemorrhages from a normal delivery. Now, afterwards, in most societies, that cord is clamped right away, which is a problem, because you're not only leaving behind up to 40% of that baby's blood that belongs to that baby, but you're also leaving behind stem cells, which have the potential to go in and clear up any of the problems that happened in the brain or elsewhere. Now, if you thicken the blood, what is it, 2,000 times more or something like that, then how is that going to affect the ability for those stem cells to go where they need to go? When you have these vitamin K factors, those areas that bleed tend to clot, and it's a little harder to clear that out than if you just leave it that way. The concern is always the minority, this vastly small percentage of children who can develop an intracranial hemorrhage, and it can be problematic. So we're now treating everybody for this problem. So I think it's important to understand the full spectrum before agreeing to the injection, and it should be your personal decision that you feel comfortable with after knowing what there is to be known about vitamin K, which I believe in the USA has been given since the 1970s, something like that, but before that we weren't giving it. The other thing is that if the baby's clotting is not full until 6 months of age, how long is your injection going to work for? So it's not completely logical that giving a huge injection on the first day of life is going to protect them over the long term. But I think that it's always a good idea for mothers to consume lots of greens during the entire pregnancy if possible, because not only do you get vitamin K that can be delivered to the baby in normal amounts if they need it, but you're also getting folic acid and magnesium and lots of other minerals that are required to build a baby.